Welcome to the Victory Education Lounge, the place where future medical professionals turn to for guidance and insight. As aspiring healers, we constantly grapple with the evolving landscape of healthcare. Today, we're delving into a question often posed in residency interviews. What do you feel is the biggest challenge facing healthcare today? So if you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of residency interview process and move one step closer to your residency goals. We'll dissect this question and explore 5 compelling ways to respond, illuminating the key issues at the heart of modern medicine. So let's dive right into this crucial conversation. First, let's understand why interviewers ask this question. It may seem like a simple query on the surface, but when we peel back the layers, it reveals a more profound purpose. It's not just about gauging your awareness of the current healthcare landscape, although that is certainly part of it. It's about exploring your ability to think critically, to analyze complex issues, and to offer thoughtful, informed insights. This question serves as a litmus test for your ability to stay abreast of ongoing developments in the medical field, to sift through the noise and identify what truly matters. It probes your understanding of the intricate web of factors that influence healthcare today, from technological advancements to socioeconomic disparities, from policy changes to global health crises. But this question doesn't stop there. It delves deeper, seeking to uncover your personal perspectives and values. It's a window into your ethical compass, revealing how you perceive issues such as equity, accessibility, and quality of care. It's a chance for you to show that you're not just a passive observer, but an engaged participant ready to confront these challenges head-on. Moreover, this question is a testament to your commitment to the field of medicine. It's an opportunity for you to demonstrate that you're not just in this for the prestige or the paycheck, but because you genuinely care about improving healthcare. Your response should reflect your dedication to making a meaningful difference, to contributing to solutions that address the most pressing issues in healthcare today. In essence, when an interviewer asks you, "What do you feel is the biggest challenge facing healthcare today?" they're not just asking for a rehearsed reply. They're asking for a glimpse into your mind, your heart, and your vision for the future of healthcare. So, when you answer, remember, you're not just stating facts or summarizing news articles. You're unveiling your philosophy as a future medical professional. This question tests your empathy, ethics, and commitment to the field. When answering, it's important to show balance. The healthcare landscape is a complex one, filled with both challenges and opportunities. Your response should acknowledge this complexity without veering into pessimism. After all, as future medical professionals, we're not just diagnosing problems, we're also prescribing solutions. Start by identifying a challenge that resonates with you. It could be a global issue, a national concern, or something you've observed in your own experiences. Remember, the question isn't asking for the biggest challenge in terms of scale. It's about what you perceive as a pressing issue that needs addressing. Once you've identified the challenge, don't just state it. Analyze it. Break it down to its roots. Is it a technological issue, a policy problem, a societal concern? This analysis demonstrates your critical thinking skills, a trait highly valued in the medical field. Next, discuss the impact. Who is affected by this challenge? How does it affect the delivery of healthcare services? How does it impact patient outcomes? This part of your response shows your empathy and your understanding of the consequences of these challenges. Now here's the crucial part. Discuss potential solutions. This shows that you're not just aware of the problems, you're also thinking about how to solve them. What could be done at the policy level? What can healthcare professionals do? What role can you play as a future medical professional in addressing this challenge? Lastly, make it personal. Connect the challenge and your proposed solutions to your own experiences and aspirations in the field of medicine. Maybe you've seen the effects of this challenge firsthand during your clinical rotations. Maybe it's a challenge you're passionate about addressing in your future career. By making it personal, you're showing the interviewers that you're not just reciting facts, you're invested in the future of healthcare. Tailor your response to reflect your personal experiences and aspirations in medicine. Remember, this question isn't just about your knowledge, it's about your critical thinking, your empathy, and your commitment to being part of the solution in healthcare. One approach is to discuss the rapid pace of technological advancements in healthcare. Technology is revolutionizing how we approach medicine. It's like we're living in a science fiction novel, with developments like artificial intelligence, telemedicine, and genetic engineering becoming a part of our daily reality. But let's not get ahead of ourselves. While these advancements offer incredible benefits, they also present a significant set of challenges. The first one is the issue of training. With every new piece of tech that hits the market, healthcare professionals need to learn how to use it. This constant learning and adaptation can be mentally exhausting and time-consuming. Next, there's the question of equitable access. Not everyone has the resources to avail these advanced treatments. How do we ensure that everyone, regardless of their socioeconomic status, can benefit from these advancements? It's a complex issue that combines economics, policy, and ethics. Then we have the impersonal nature of technology. Machines may be efficient, but they lack the human touch. A computer can diagnose a disease, but it can't hold a patient's hand or offer words of comfort. Healthcare is about more than just curing illnesses. It's about caring for people. And that's something no piece of technology can replicate. Finally, there's the ethical conundrum. As we push the boundaries of what's possible in medicine, we also push the boundaries of what's acceptable. Genetic engineering, for instance, offers incredible potential for disease prevention, but also raises questions about genetic privacy and the potential for misuse. Addressing these challenges isn't easy. It requires ongoing dialogue, constant learning, and a commitment to putting patients first. The key, perhaps, lies in striking a balance. A balance between embracing the potential of technology and preserving the human touch in healthcare. A balance between pushing boundaries and respecting ethical limits. A balance between making healthcare more efficient and keeping it accessible and equitable. Addressing the impersonal nature of technology in patient care is a challenge we must face head-on as we continue to innovate and evolve in the field of healthcare. Because at the end of the day, healthcare is all about the patient, and we must never lose sight of that. Alternatively, you could talk about healthcare accessibility and equity. This topic is a mirror reflecting the systemic issues embedded within the healthcare landscape. It's a vast ocean, with waves representing different aspects of accessibility and equity, each one presenting its own unique set of challenges. To begin, consider the issue of geographical accessibility. Many individuals live in areas known as healthcare deserts, where clinics and hospitals are few and far between. This lack of proximity to healthcare facilities can lead to delayed or missed care, exacerbating health conditions and increasing the risk of serious complications. Then, there's the question of financial accessibility. The costs associated with healthcare can be daunting. From insurance premiums and co-payments to the price of medications and medical equipment, these expenses can place necessary care out of reach for many individuals and families. Furthermore, let's not forget about cultural accessibility. This involves providing culturally competent care to diverse patient populations, acknowledging and respecting their unique beliefs, values, and customs. It's about ensuring that language barriers do not hinder the delivery of quality care, and that healthcare providers are trained to understand and respect the cultural nuances that can impact patient care. And how about the issue of equity? Healthcare equity is about ensuring that everyone has a fair opportunity to attain their full health potential. It's about recognizing and addressing the social, economic, and environmental factors that influence health outcomes, from income and education to housing and neighborhood conditions. Addressing these issues in your answer shows an understanding of the intricacies of healthcare access and the disparities that exist within the system. It shows that you recognize the importance of advocating for policies that promote accessibility and equity, and that you're committed to being part of the solution. It reflects a deep understanding of systemic issues in healthcare. Given recent events, discussing the impact of global pandemics is highly relevant. The advent of a worldwide health crisis has unveiled the vulnerabilities of healthcare systems across the globe. As a future healthcare professional, it's crucial to understand and contemplate these challenges. Firstly, let's consider the strain on healthcare systems. As we've seen, a pandemic can rapidly stretch resources to their limits. Hospitals can become overwhelmed, with staff juggling between an increased patient load and the necessity of stringent infection control measures. The supply of critical care resources such as ventilators and ICU beds can be stretched thin, and the distribution of these resources becomes a pressing issue. Moreover, a pandemic can expose gaps in public health infrastructure. It can spotlight the need for robust disease surveillance systems, the importance of timely and accurate testing, and the value of effective contact tracing. It also underscores the critical role of primary care in managing the majority of patients in the community, thereby reducing the burden on hospitals. Furthermore, a pandemic can also highlight social health inequities. Those with limited access to healthcare, the underprivileged and marginalized communities, often bear the brunt of the crisis. It's a stark reminder that health is a global issue, and that no one is safe until everyone is. Finally, a pandemic emphasizes the importance of global cooperation in health. Viruses do not respect borders, which necessitates international collaborations for disease surveillance, research, vaccine development, and distribution. It's a test of our collective ability to respond to global health emergencies. In the wake of a global pandemic, it becomes clear that healthcare is more than just treating individual patients. It's about systems, policies, and global collaborations. As future healthcare professionals, we must be prepared to engage with these complex, interrelated challenges and contribute to solutions at every level. The importance of global cooperation in health. Another angle is the issue of burnout among healthcare professionals. This is a topic that has gained considerable attention in recent years, but the reality is, it has been a persistent challenge within the medical field for decades. Burnout, characterized by emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment, is prevalent among healthcare professionals. It's a consequence of the high-stress environment, long work hours, emotional demands, and the constant pressure to make life-altering decisions. The work environment in healthcare is unlike any other. It's a world where every second counts, where the stakes are literally life and death. The emotional toll this takes on healthcare professionals is immense. It's not uncommon for doctors, nurses, and other healthcare workers to feel overwhelmed, emotionally drained, and disconnected from their work, leading to burnout. But it's not just about the emotional toll. The physical demands of the job can be just as taxing. Healthcare professionals often work long, irregular hours, sometimes with minimal breaks. This lack of work-life balance can further contribute to feelings of burnout. In addition to this, there's the importance of mental health. Ironically, in a field dedicated to caring for others, self-care can often take a back seat. There's a culture within healthcare that often equates seeking help for mental health issues with weakness, further exacerbating the problem. Therefore, addressing burnout among healthcare professionals isn't just about reducing work hours or providing stress management courses. It's about changing the culture within healthcare. It's about recognizing that healthcare professionals are human too. They need to be allowed to express their emotions, to seek help when they need it, and to have a life outside of work. This is why the importance of mental health and work-life balance in medicine cannot be overstated. It's not just about improving the quality of life for healthcare professionals. It's about improving patient care because a burnt-out doctor cannot provide the best care possible. The importance of mental health and work-life balance in medicine is an issue that needs to be addressed head-on. It's a challenge that demands our attention, understanding, and action. Lastly, consider addressing the challenge of misinformation in healthcare. We live in an age where information, accurate or not, can spread with the click of a button. This has immense implications for healthcare, where wrong information can have severe, even fatal consequences. Patients are increasingly turning to the internet for health advice, often encountering a deluge of conflicting articles, blogs, and social media posts. This can lead to confusion, misinformation, and ultimately, poor health decisions. The problem is exacerbated by the fact that medical jargon can be difficult to understand for the average person, leading many to rely on oversimplified and often incorrect interpretations of complex health information. This challenge is not just about dispelling myths and correcting false information, it also involves proactively educating patients and the public about their health. As future medical professionals, we have a responsibility to ensure our patients have access to accurate, comprehensible, and actionable health information. To tackle this, healthcare providers need to develop solid communication skills. This isn't just about effectively conveying information, it's about listening to patients, understanding their concerns, and responding in a way that respects their values and preferences. In addition, patient education should be a priority. This means not only providing information during consultations but also developing resources that patients can refer to later. These resources should be easy to understand, yet comprehensive enough to provide valuable insight. This approach goes beyond treating diseases. It's about empowering patients to take control of their own health, making informed decisions, and ultimately improving their health outcomes. It's about building trust, fostering open dialogue, and promoting health literacy. Given the complexity of this challenge, it's clear that tackling misinformation is not just the job of an individual. It requires a concerted effort from the entire healthcare community, from doctors and nurses to policymakers and educators. In conclusion, the challenge of misinformation in healthcare is a significant one, but it's also an opportunity for us as future healthcare professionals to make a real difference. The importance of communication skills and patient education. Each of these answers provides a unique perspective on a major healthcare challenge. Remember, your response to this question isn't about finding a single correct answer. It's about presenting your personal understanding, values, and vision for the future of healthcare. Show your interviewer that you're not just knowledgeable but also empathetic, ethical, and committed to making a difference. As you prepare for your residency interviews, keep these insights in mind. As you embark on this exciting journey, remember that preparation is key. Take your time, be thorough, and most importantly, believe in yourself. You've come this far, and a rewarding career in medicine awaits you. Now that you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of residency interview process and move one step closer to your residency goals. As always, thank you for joining us at Victory Education Lounge, and good luck with your interviews.